Okay, well, welcome back to the What's Next Class Survivorship Edition. I'm your host, Dr. Dave Bullis, the Director of Ambulatory Medicine here at the Cancer Center. The What's Next class has been put together with all the effort of our support staff here at the Cancer Center. And this is episode 3, What to Expect Physically. So, what are some of the common concerns with physical health after cancer treatment? I will say, just as a caveat, these vary for different patients. Not everybody has all of them. Some people have very few. Some people have everything. So I'm just going to go sort of over the over-inclusive list. So it doesn't mean you're going to have these if you haven't already. But these are some of the common concerns. Sometimes people do have cardiac issues, heart issues, depending on the medication. Anthracycline medications sometimes affect heart function. Radiation exposure, depending on where your cancer was, can sometimes affect cardiac function, as I'm sure you were well aware and were instructed about when you were getting radiation treatment, if that was one of your treatment components. Pretty much everybody does experience fatigue. Sleep is a very, very common challenge. Pain, both during active treatment and then also in subsequent recovery and in survivorship, continues to be an issue for many people. Getting strength back, again, likewise, is a common challenge for folks. Diet challenges and weight changes are also, they're related, of course, but those are things that many people struggle with, both in active treatment, both because of the actual treatment itself, and then trying to recover in the survivorship phase. So what we're going to try to do is sort of go through each concern and then talk about what you can do about it, sort of put our money where our mouth is here. So cardiac concerns, examples of that could be shortness of breath or chest pain after exercise, or even shortness of breath while lying still when you're in bed. So one of the possible solutions, and something we actually obviously recommend, is that if you are having shortness of breath or chest pain for any reason at any time, I think it's important to ask for a workup with a cardiologist. Obviously, it's very common that you're going to get one of those anyway, but if you haven't had one yet, it's especially helpful. If you personally have a family history, siblings, parents, etc., who may have had heart problems in the past, it's especially a good idea if you haven't already had a cardiac workup to get one. We have cardiologists here at Newton-Wellesley Hospital who are expert in this, and so it's not hard for the oncology team to get you hooked up with somebody who can help. So then shortness of breath while lying still, one of the things to do, and we'll talk about this in other areas as well, but making an effort to get some exercise every day. And this is a challenge, of course, because if you have low energy and low output and you're feeling weak, getting up and just going out for a run doesn't seem like it's a very viable. So what we recommend is you really start with small doses of exercise. And that seems like a silly concept in some ways, but it really is this idea of even if you just get up and move around your house, anything counts for exercise. We'll talk about that later as well. But even if you're just doing 15 minutes at a time, kind of the heart is a muscle, just like your leg muscles or your back muscles or your arm muscles. And when you exercise the muscle, it gets stronger. So making an effort to get some of that exercise every day will help build it up slowly over time. Diet actually turns out to be a really important part of heart function. And we'll talk more about that in a couple of minutes. But basically, getting some consult about making sure you're eating a heart-healthy diet can actually be very useful in helping reduce any complications or things like high cholesterol or too much salt, which can make heart function harder than it needs to be. There are emotional factors that contribute to heart issues, such as anxiety can oftentimes be confused with chest pain. So that's another reason to talk to the cardiologist and also talk to your neighborhood psychologist or social worker who is also here to help reduce any kind of emotional contribution to the heart challenge. And then if you haven't already, this is my plug to quit smoking because smoking just makes everything worse. So it's certainly going to make your cardiac function worse. So if you have any interest in quitting smoking, we can certainly help with that as well. We have a Quit for Good program, which is another set of videos on this same website, but also just recognizing that quitting smoking is something that you can proactively do to really improve your overall health, but certainly your cardiac health. Fatigue. So there's lots of reasons for feeling fatigued. One of the things we want to be really clear about is the fatigue related to cancer care is not the fatigue or tiredness you feel after you've raked leaves in the yard or gone for a nice hike in the hills. The fatigue, this is what most people describe it as feeling more like drained. Like when your cell phone battery is drained, your cell phone doesn't work. It's that same idea that when people feel tired, they're really talking about feeling like they just don't have any energy at all. And that is obviously it's unique to this process, and it's one of the most concerning factors for people. So there's a lot of different reasons for it. So let's just start off with the first, which is just because you're not getting a good night's sleep. So one of the things about sleep hygiene, and that's sort of the technical term, and that's just kind of like dental hygiene, and you brush your teeth every day, I hope. And so same idea here, where you want to set up a routine where you try to go to bed and wake up around the same time every day, and that structure and that routine really helps kind of regulate the sleep cycle. One of the things that keeps people up at night is having to go to the bathroom, especially for men of a certain age. So this is, but it's true for anybody. So what we recommend is you do have to drink a lot of water to kind of help your body heal and get back to full strength. But if you can try to drink most of your fluids in the first half of the day and then slow up on the fluid intake especially after dinner, then you won't have a full bladder, and that can help with getting through the night. We also strongly recommend having no electronic devices in the bedroom, which is oftentimes a challenge for people because people do like to watch TV in bed. One of the problems with that is that the light from the TV can keep people up and also keeps people's minds active. And what you really want is you want your bed to be quiet and dark whenever you're in it. For some people who are sensitive to caffeine, we certainly don't want to take anyone's morning coffee away. I think that's a crime in and of itself. But caffeine after lunch, if you avoid that, then any caffeine that you have taken in earlier in the day will have worn off. Likewise, if you're eating a big meal right before bed or have a big snack right before bed, that means your body's going to be digesting that food, and the digestion itself can keep you awake because your body's sort of working harder than it needs to. So having a healthy dinner and then avoiding the midnight snack will help with sleep. Alcohol is an interesting thing. Many people think that I have a little nightcap with the alcohol. It kind of helps them fall asleep. But it turns out, the research shows that it may actually help you fall asleep. But then when the alcohol wears off, that your body rebounds and wakes you up. So it turns out that it's kind of counterproductive in the end because although it does knock you out at first, it wakes you up later in the middle of the night. Again, so continuing on with the not a good night's sleep, the other part, you may be on a fair number of medications, new ones, as a result of the cancer treatment. It's a variety of other things. And so it's always good to just sit down with your medical provider, either your primary care doc or your oncologist when you see them, and just review all the medications that you're on, both over-the-counter and prescribed, because sometimes certain medications do have a side effect of insomnia, and or in combination, some of the medications kind of interact with each other and can keep you up. There may be other medical issues, and again, this is where you talk to your primary care doctor about other medical issues such as weight or sleep apnea, getting a sleep study, endocrine issues or anemia. All of these things can contribute to your body's metabolism being kind of dysregulated and kind of out of whack, and that can sometimes contribute to insomnia. If it is true that one of the things you're concerned about or worries about the future, or you're ruminating about what might have been in the past, and this is a not uncommon thing to happen in the 1 a.m. to 5 a.m. time slot, is that people wake up for any reason. They have to go to the bathroom or something, and then the mind starts going. And we'll talk about that in a subsequent episode. But I think it's important to know that you can ask, certainly here at the Cancer Center, in Vernon Cancer Center, you can ask to talk to our wonderful social worker or myself, the psychologist, because there are things we can do to help reduce anxiety and depression while you're going through this. Sleep medicine, as I noted above, there are sleep medicine experts here at the Newton-Wellesley who can help evaluate what your sleep cycle is, and if sleep apnea is an issue, assign medical treatments for that as well. And then we do have an excellent nutritionist here and nutrition advice. There are actually foods that will promote sleep, ones that are rich in this thing called tryptophan. And then there are other foods that are more activating, that are full of protein or other things. Although this may not have been an issue prior to cancer treatment, your body may be more sensitive to those right now. And so a nutrition consult is oftentimes useful. So if you're still awake, so if you go to bed and you are still awake after 20 minutes or so, it is okay, and actually in fact recommended, to get up and spend some time and doing something to kind of burn off some of the excess energy. One of the things that happens with folks who are going through a recovery process is that they are too tired to get up and exercise, but their mind has a lot of energy, and so they have a lot of sort of mental energy to burn off. And so reading or doing a breathing relaxation exercise, or even stretching, or even doing something physical can help burn off some of that energy, and that can help promote getting back to sleep when you try. What we're trying to help people not do is sort of just lie in bed and toss and turn and think about how much they wish they were asleep, and kind of worry about the fact that they're worrying about not going to sleep, and that cycle just makes it worse. So it's okay if you've tried for a good 15-20 minutes and it hasn't worked yet to try something else. So if you are sleeping through the night, that's great. But if it's still not enough, like you wake up tired, you feel like you're dragging throughout the day, that no matter how much sleep you get, you're just not quite getting back on track, that's an understandable thing and very common. And so part of it's really in the early stages of recovery. So that your treatment may have ended, within the last month or so. It's important to understand that your body is still healing. It is still recovering. It's still the actual cells in your body are recovering and healing. The body is still flushing out some of the old dead cells that were killed by the chemo or the radiation or whatever. And that takes energy. It just does. And so that's this process of just recognizing that people oftentimes will feel like, well, I'm done with treatment, I should be back to normal. And that back to normal will come, most likely, but not in the first week. And for some people, it's a matter of months. So being sort of more sympathetic with yourself is a first step at sort of understanding that takes time. It is true that when you are awake during the day, if you can get outside and get some natural light, some sunshine on your face, that can actually help with the sleep-wake cycle. The research has shown that the sun on somebody's face actually helps reset that cycle. And so, but it's very common when you have been going through treatment that your sleep cycle may have been off, that when you were in active chemotherapy, for example, you may have been so exhausted by the treatment that you were sleeping in the afternoon, and then we're not able to sleep at night, and then that cycle continues even after treatment is completed. So this is really recognizing that you want to try to get yourself back on that sleep cycle. It's a little bit like if people have traveled internationally and kind of found out that when they were in a different time zone, their sleep cycle was off. So it's the same idea here, is you want to kind of get yourself up with, when the morning is happening, and then outside as much as you can, weather permitting, and then be ready for bed when it's dark. Again, you're going to hear this a lot, but a nutritional consult can certainly help because there are foods, again, that help put you to sleep, and there are other foods that help energize you, and you can be more in control of the nutrition part of your life, and that can actually help manage some of the energy level. Again, you'll hear this multiple times throughout these exercises, throughout these slides, is that exercise is a very important component, not only to overall health, but certainly in this concept, getting your sleep-wake cycle back on track, and also managing your energy. This is one of those things where it seems counterintuitive because, of course, when you're tired, the last thing you want to do is go out and exercise. But as you saw in an earlier slide, even if you just do 15 minutes of exercise, walk out to the mailbox and back, or walk to the corner and back, you're beginning to train your body to use its energy proactively, and then that helps fulfill itself, and you kind of can build on that routine. But because energy is, you just can't come up with it out of nothing. We talk about a lot folks pacing themselves throughout the day. And this is the idea of instead of trying to take on the whole task of I'm going to go out and mow the whole yard, or do all of the laundry, or pay all of my bills, maybe I can just take a chunk of time. I'm going to take a half an hour and just do as much as I can on this project. Like, say, paying the bills, I'm going to do a half an hour of that and get them organized and figure out what needs to get paid. And then I'm going to stop. And then I'll come back and do another chunk of that later. But one of the ways to kind of build up your endurance and your energy level is to take small chunks at a time. One of the other things that we do have the option for here at the Vernon Cancer Center is a physical therapy evaluation, because there are exercises that can help not only with energy conservation, and so you don't have to kind of exhaust yourself doing the normal projects, but also strength and training and endurance training that can help give you a safe way of getting that regular exercise and getting outside that we just talked about. I should just say that that's called strength in motion, in case anyone's asking. All right, so pain, moving on to pain. So pain can have many different causes, and so part of that is just recognizing that there can be very different treatments for the pain. So one of the possible solutions right off the bat is there are 6 things we want you to tell every provider, and this is your primary oncologist, your primary care physician, basically anybody who has a medical degree of any sort who will listen. You want to tell them 6 things. One is where it hurts, the place it hurts, and you want to be as specific as you can. And if it hurts in multiple places, don't be shy, tell them every single one. You want to tell them how bad it hurts. Now, this is something that people will often ask on a scale of 1 to 10, 10 being the worst pain ever imaginable. Now, this is 1 to 10 based on your experience, not some kind of absolute scale, but you want to give them a sense of how bad it hurts. There are intensifiers. There are things that make it worse. So when I sit in a car all day, or when I sleep in a certain position, or whatever, those are the things that make it worse. And then you also want to talk about the nullifiers, or the things that make it better. So after I've had a hot shower, after I've taken some Tylenol, after I've listened to some, music, that can make it better. And then you want to talk a little bit about, like, what's the impact? Like, in what way is that pain interfering with your life? this is one of those sort of indirect symptoms of pain that oftentimes gets missed, but I think it's really important for the providers to know that this pain is having a very direct impact on your life. There are some people who have relatively high degrees of pain, but it's not interfering with their day-to-day function, and so those treatments tend to be different than the people who say, I am disabled by my pain. And then the final, the sixth item is a descriptor. And this is really trying to get at, because different kinds of pain present differently, and there are different kinds of treatments for the different kinds of pain, you want to be as explicit as you can about what your pain feels like. And I encourage people to be as graphic as possible. So if it feels like someone is stabbing you with a hot serrated knife in your low back, that's a really important descriptor, because that is sharp, it is burning, and it is very focused on where it is. If it's a dull, throbbing ache like someone's sitting on my chest, that is crushing, that's a very different pain and responds to a different kind of pain medicine. And you may have different types, so being able to describe the pain in, if you pardon the pun, excruciating detail, that helps the providers be more focused on what pain medicine and treatments, if it's not medicine, what treatments are going to be. For those who are interested in acronyms, the 1 through 6 spells out PAINED, or pained, and that's a clever palliative pain management technique for remembering that. But you want to talk about where it hurts, how much it hurts, what makes it worse, what makes it better, how's it interfering with your life, and what does it really feel like. The more your providers know all those things, the better they can help. So you may find that the medications that you're on are not working as well as you'd like. This can be for a couple of reasons. One, it's not the right dose, or it's not the right medication. But there also may be one of those things where you're having some nerve pain and some muscle pain and some bone pain, and you may be taking a pain medicine that's good for the nerve pain, but not so good for the bone or the muscle pain. So again, talking about where it hurts and what it's like in as specific a way as you can. That way they can come, the providers can come up with the right sort of recipe for what's the right medications you have. One of the challenges with pain medicine, of course, and pain management in general, is that every medication has some kind of side effect. And that's true whether it's a pain medicine or not. And so basically, you may be experiencing some of the side effects of the pain regimen, which are getting in your way. And a common one, of course, is fatigue or drowsiness. So what we're really trying to do is we're really trying to aim at giving you the smallest dose of the most effective medicine that, and then also maximize alternative strategies that are not related to medicine. And that recipe in general, that sort of kind of overall kind of plan allows people to have the best pain medicine response. People oftentimes get nervous when we talk about smallest dose, but it's really the smallest dose that's effective. So we could give you a gallon of a medication that would be extremely effective. You'd be asleep for the rest of your life, so that wouldn't necessarily be functional. So we're really not talking about knocking your pain out and you as well. We're really trying to help you be as functional as possible, and that means we want to give you the least amount of medicine that's going to help. So that's what we're really kind of aiming for. So the medicine may not seem like it's helping enough, or the effects can feel like too much. So in addition to the medications, there are other things that we also recommend that be done at the same time. And I want to be clear that these are not saying that you should not take pain medicine and you should just do these other things, but more recognizing that you want to attack the pain from every direction possible. And so the medication, if you're taking a low dose that is effective, but it's not effective enough, the things you can do in addition are talking to the pain treatment team. And we have pain specialists here at Newton-Wellesley and also at our outpatient ambulatory care center at Wells Avenue that can help you think about whether ice or heat on this specific spot can help. Stretching, range of motion exercises, strengthening with a physical therapist or a trainer, massage or Reiki, relaxation techniques like yoga, meditation, breathing relaxation. There's also cognitive behavioral skills to improve sort of mental control over one's pain, acupuncture, even a TENS unit, which is an electrical nerve stimulation unit that just sort of, there are patches that go on your skin, and there's a little electrical low dose, a very low dose electrical pulse that goes through and kind of blocks the nerve signal. That can also be possible. So those are some non-medical things, and these are all possible through the Spine and Pain Center at Wells Avenue. Even the cognitive behavioral therapy, there's excellent staff there who do that. And then there are also non-pill interventions, and those include injections like trigger point injections or nerve blocks, Botox injections are sometimes used, and then also topical things like topical ointments or lidoderm patches or even steroid injections. So these are all things that can be a part of your overall pain management routine. So basically, this is not an exclusive list, but these are the kinds of things you want to be asking for a referral to a pain specialist about, and then also when you meet with that pain specialist, talking about what are some of these options that might be appropriate for your care. Okay, so next, there can be pain that's due to lymphedema. Lymphedema is a swelling in the extremities, like your legs or arms. And it can occur in one or both of your extremities. It's mostly caused by removal or damage to the lymph nodes. And lymph nodes, as you know, are sometimes taken out as a part of the diagnostic process and also part of the treatment process. So there are a variety of solutions around lymphedema. One is compression stockings for the arms or the legs. And this just compresses the tissue so the fluid can't back up in the arm or leg. With some specific training with a physical therapist, you can learn how to do some resistance training and building the muscles, which also your muscles turn out to be the best pump you can have for pressing the fluid out of the tissue around the muscles and whatnot. So learning about progressive resistance training, getting physical therapy for range of motion. There's even manual lymphatic drainage where a special therapist can actually massage the fluid out of your extremities, and that takes special training. We do have that here at our ambulatory care center, so that's something to certainly ask about. And then on your own, it's also important to try to be active every day. If you are sedentary and sitting on the couch a lot, the lymphedema can sort of build up, and then once it builds up, it's hard to overcome. So kind of staying ahead of it with the compression stockings and then learning some of these other techniques can be helpful. So people get out of shape, and then it's hard to know how to get back in shape. And it is a cruel truth that it takes very little time to get out of shape, and it takes a long time to get back into shape. And this is not just related to cancer care, that's related to life in general and being human beings, but nevertheless, it's an issue. And so one of the first things, this is not going to sound too surprising, but avoid inactivity. And I just want to be clear here that any movement counts. Getting out of bed and walking to the kitchen when you have low energy may be what you can do that day. Like I said before, walking out to the mailbox or walking to the corner of the block and back, maybe that's enough at first. But we want to encourage you to do at least that every day. And then as you feel more up to it, you can push yourself a little bit. One of the ways I encourage people to to do this is you want to do the basic level of exercise you can do until you're bored with that. And when it's boring, then add just a little bit more. So you walk to the mailbox 2 or 3 times a day until that seems silly and boring, and then you walk to the corner and back, and you do that until that's boring, and then you walk around the block until that's boring, and etc. So you build yourself up slowly over time. I think it's good if you have abilities or interests that you want to do. You might like walking in the woods near your house. That's more interesting than walking around the mall or just walking around your house. So try to do that. It's something that is a motivator for you. Obviously, if it's pouring rain or 100 degrees or 0 degrees, you might not want to do that. But recognizing that, go with your strengths, what you're already interested in. So the official recommendation for anybody who's trying to get back in shape is to try to do at least 150 minutes of moderate intensity workout each week. Moderate means kind of you break a little bit of a sweat and you're kind of breathing a little bit hard. You're not going full out and your face is all flush, but it's not just kind of ambling down the road. You're giving yourself a little bit of an extra push. Whether that's five times a week, half an hour, or 3 times a week for almost an hour, you get to decide, and it doesn't matter whether you do 150-minute episode, although I wouldn't recommend that, or you do 151-minute episode. You really want to just make sure that you're doing regular exercise every week. It's also true that if you can, and this is where our physical therapy and training staff at Wells Ave can be really useful, but 2 to 3 sessions of strength training of the major muscle groups, your legs, your back, your arms, those also help build yourself back up. Again, you'd want to start with very, very light weight at first and then build yourself up over time. Don't take my word for it. That's probably better trained by a physical therapist who can give you more specific ideas about that. Stretching sessions also of the major muscle groups every week with massage or yoga or just learning how to do stretching with the physical therapist can be very useful in terms of keeping the muscles limber, and that also helps make moving less of a chore. I guess so if you have lymphedema, this is just going back to the lymphedema thing, you want to keep the compression garments on during exercise so that the body is used to kind of not letting the fluid get down into the legs to begin with, or the arms. Again, this is what I was just saying about starting with small weights and low resistance, and then slowly building up over time. If the lymphedema is getting worse, then you want to stop and get another medical consult. But if it oftentimes will help the lymphedema get better or at least not get worse. It is okay to continue to use whatever part of your body, whatever leg or arms is being affected. So really trying to keep that full range of motion going. Again, this is one of those things where if you can stop it from getting worse, then you maintain the function. And so that's an important thing to just in general. And then, of course, just what I've just already been talking about with strength and motion as a consult here at the Cancer Center or lymphedema PT at Wells Avenue for specific exercises, then I strongly recommend getting a consult at least just so you know what you can do safely, even if you want to do it on your own or at a gym of your choice. So for certain people who have had gastric surgery, GI surgeries, and they have an ostomy, getting back into shape can be onerous. It can be difficult physically, mentally, and emotionally. And so one of the things that we recommend is that the ostomy bag be emptied before working out. Start with very low weight and low resistance and progress very slowly. And this may sound silly, but avoid contact sports if you had any interest in doing contact sports. And we have ostomy nurses available here in the hospital, and certainly you'd want to talk to them about what would be a safe way to exercise with your particular setup. Peripheral neuropathy, which is that nerve tingling and electric kind of pain or numbness in the extremities, mostly fingers and toes and feet are the most common areas where it's an issue. You want to think about non-weight bearing. This is all again about getting back into shape, and think about non-weight bearing exercises because oftentimes balance is affected. So getting on a stationary bike, getting in the pool, doing water aerobics where balance is not such an issue. Oftentimes using padded gloves like cycling gloves with the weights when you're lifting weights, and having weights that have a soft kind of rubbery texture can make them easier to grip and easier to feel. Again, the physical therapist can give you lots of ideas about how to get your balance back, and general tips for how to be mobile and safe if you have to have if the peripheral neuropathy is an ongoing issue. My diet got off track during treatment. So this is a common thing, obviously, because people have a hard time eating during treatment sometimes for any number of reasons. So here's some diet exercises. I just want to say off the bat that I'll be encouraging you to get a nutritionist consult at the end of every slide here. So just know that that's coming. But the short answer in terms of general advice is you want to stay away from processed foods with added fat and sugar. That's going to go a long way toward helping your body get healthy and stay healthy. The general recommendation in nutrition circles and in healthcare in general is you want to have 2/3 of your diet be vegetables, fruits, or whole grains or beans. And the nutritionist will show you a plate, and with 2/3 of it will be good, healthy veggies and fruits and whole grains. 1/3 of it can be protein of poultry, fish, legumes, low-fat dairy, nuts, that kind of thing. So that's the right proportions. Red meat seems to have gotten a bad reputation lately, and so people recommending staying away from red meat. Certainly processed meats like deli meats, although they're delicious for delis and cold cuts have had a because of the salt content and the processing of them have been found to be not great for a diet. Soy-based foods, tofu, other things like that, should be limited to about 3 servings a day or less. And that's mostly just because you want to have a variety of protein and nutrition in your body. And if you put too much of one type or another, that can be not good for the balance, the overall balance of your diet. Mega doses of vitamins and minerals. This is kind of a controversial area. There's a lot of research or quote unquote research and data online about the power of mega doses of vitamin C, for example, or other things. And unfortunately, the data just doesn't back that up, that your body only uses a certain amount and it just flushes out the rest. So taking mega doses of something actually isn't going to help all that much. There are some new information coming out of, say, Sloan Kettering in New York, where there's some more detail about what is the right vitamin balance and minerals. So I strongly urge consulting with your medical doctors, primary care or oncology, or both, about what's the right over-the-counter vitamin supplementation. In general, the advice is to get all your vitamins and nutrients from your diet rather than adding supplements. But it's always good to ask your medical team for specifics. So sometimes people find they've gained too much weight during treatment. So that's not always common, but it can happen. And if that's true, obviously shifting your diet away from the high-fat, empty calories like sugar, sweetened drinks, desserts, fried food, all the things that are yummy and we look forward to. Those empty calories just make it hard for your body to process and digest. It can be helpful to have meals on smaller plates. This is something that portion control is a huge issue. If you go out to restaurants, oftentimes you get a plate that looks like it would serve a family of 5. And so we're sort of used to bigger plates nowadays. I think one of the ways you can have some control is to really put the food on a smaller plate, and then if you're still hungry a couple hours later, you can maybe have something else. But in terms of managing the diet, what you're putting into your body goes a long way in terms of helping control the weight. you can get consults of this, again, with our nutritionist, but learning to read the nutritional information on the food labels that are attached to all food products at this point. You can learn more about what you're eating, and it turns out that there's a lot of things, some foods that are, low sugar or high salt, and some ones that are good for, that are low carb or high protein or something. So it's helpful to learn what's going into your body, because then you can be more in control of how you're managing the weight. Again, if you go online to look at weight loss and what other kind of off-market things are available, you may read a lot about weight loss supplements, diet pills, that sort of thing. And we strongly recommend staying away from those as well, mostly because they have other health impacts. They're really a stimulant. They can make you much more anxious and edgy, a variety of other things, and not to mention also having a hard time sleeping at night. Although they seem like it's a great idea to take one pill to fix all the problems, it turns out that just doesn't work. And so we strongly recommend against weight loss supplements in that sense. More common problem is I've lost too much weight during my treatments, and this is mostly because it was hard to eat when I was in treatment, and then I never kind of caught up. So one of the ways to manage that is what I call grazing, and I mean no offense by that, but more just eating smaller meals more often. And it turns out your body doesn't care quite so much about when it gets its calories as long as it gets them. So having a cup of yogurt and some nuts in the morning, and then a couple hours later having some bread and cheese, and then a couple hours later having something else, you can get all your calories in over the course of a full day, rather than 3 square meals like maybe you did before. It also can be helpful if you need to drink a lot of water, to not drink a lot of water right before you're trying to eat, because you might get filled up on water and then not have room for the actual sustenance of the food. And so you sort of want to have enough water or liquid to wash it down, but not so much to fill yourself up. So sort of thinking about, I'm going to have my fluid while I'm watching TV, and then I'll stop and then go have something to eat, and then I'll come back and have my more fluid later. Again, it never hurts to advocate for quitting smoking. That is something that does make it hard to gain weight. And oftentimes people smoke as a way of losing weight or quenching their appetite. But if you've lost too much weight, then smoking is not healthy for you. I mean, obviously for any number of reasons, but certainly for, in this case, around gaining weight. And again, it is common when one's going through a challenging process to have a couple of drinks of alcohol. And alcohol, although it has many positive attributes to it, does have a lot of calories that turn out to be empty. So you get calories without getting full. And so it's very hard to manage your weight if you're getting too many calories from alcohol. We also do have available to us here a speech-language pathologist who can give you an evaluation if you're having any trouble swallowing the food. It's actually a mechanical issue, and that can happen as a result of certain kind of cancer treatments. It depends on where the cancer was. If it was in your throat or mouth or neck, oftentimes that's an issue. So it can be very useful to have a speech-language evaluation, if you haven't had one already, to manage any trouble with swallowing of food. So that's sort of the summary. So basically, it is normal and expected to have a lot of physical effects after a full course of treatment for cancer, especially if you've had the full course of surgery, chemo, radiation, and more chemo. Your body has been kind of essentially beaten up by all the cancer treatment, and it takes time for that to heal. And so in one of the ways I talk to people about this idea is that when your body is feeling those effects, your body's really recognizing all that it's been through. The recovery often takes longer than you expect, weeks to months even, after treatment has ended. And one of the reasons for that is that when we're giving you the cancer treatment, it's really like tearing down one of those old derelict houses in your neighborhood. It takes a lot of time to to crush the house and get rid of it all. And then there's this process of having to kind of clean up that mess. And that's what your body is doing. In between treatments, even while you're in the middle of radiation or chemo, your body is cleaning up the mess. The chemotherapy and the cancer treatment of whatever sort kills the cancer cells, but it doesn't magically make them disappear. The getting rid of them, the flushing them out of your body, that's something that your body has to do. That takes a lot of energy and it takes time. So people oftentimes will end up finishing up the treatment and think that they're ready to go. And really at the end of treatment, what you've got is a nice clean slate that your body's then going to rebuild. So it's achievable to get better, but you still have to kind of take it one day at a time. So that's part of this process that we just want to help you. The things we've just talked about are all areas that you can have some control over while you're helping your body get back to baseline. So that's the end of chapter 3. Please stay tuned for more episodes.